On anxiety, and anxiety refers to specific psychiatric disorders that involve extreme fear or worry, including general anxiety disorder, panic disorder, social anxiety and separation disorders, as well as certain phobias. Anxiety is defined by the American Psychological Association as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. Six of the most common anxiety disorders include generalized anxiety disorder, social anxiety, phobias, panic disorders, OCD or obsessive compulsive disorder, and PTSD or post traumatic stress disorder. Social anxiety is anxiety relating to certain social situations. Phobias are irrational fears that lead to negative impacts on one's everyday life. Panic disorders involve panic attacks, which are the sudden onset of feelings of danger when there are no real threats there. OCD, or obsessive compulsive disorder, is uncontrolled reoccurring thoughts or actions that again negatively impact one's everyday life. And then PTSD, or post traumatic stress disorder, relates to anxiety around a traumatic event in one's life or difficulty recovering from that event. There are different symptoms for specific anxiety disorders, but overall, the symptoms can be mental as well as physiological, like feelings of nervousness, restlessness, having a sense of impending danger, panic, or doom when there isn't one, as well as increased heart rate, high blood pressure, breathing rapidly, sweating and trembling, or reoccurring thoughts of terror. Anxiety in college students. Anxiety is pretty common among college students. A survey reports that 3 out of 4 college students have felt anxiety at some point in their lives, while an estimated 41.6% of college students have been diagnosed with an anxiety disorder. And this is because academic environments tend to put a lot of stress and pressure on students, as well as college being one of the most major life transitions in a person's life, going from having a home life to gaining new independence and responsibilities that they might not have had before, as well as many college students balance multiple responsibilities like part-time or full-time jobs, studying, school, as well as extracurriculars. There are different treatments for anxiety. Both medication and therapy, or a combination of both, tend to work well for many anxiety disorders. The most common forms of medication include SSRI, which is selective serotonin reuptake inhibitor, as well as SNRI, which is serotonin norepinephrine reuptake inhibitor, and then also antidepressants as well have been used to treat anxiety. Therapy usually involves skill learning and actively keeping the patients involved. The most common is cognitive behavioral therapy. And that's my presentation. Thank you.